We're starting the news this night with health, as the United Nations Children Education Fund UNICEF Nigeria has intensified its advocacy for increased uptake of the human papillomavirus HPV vaccine among young girls in Osun State, identifying it as a crucial step in the fight against cervical cancer. This was the focus of an engagement session on adolescent and youth-led action on HPV vaccine and adolescent health promotion organized by UNICEF Nigeria in Osogbo, the Osun State capital. Correspondent Kaudi Oladosu reports.
Cervical cancer is the second most common cancer among women and girls in Nigeria. Despite the availability of the human papillomavirus HPV vaccine, Osun State still records low uptake. To address this, UNICEF Nigeria organized a workshop under its Adolescent and Youth-Led Action on HPV Vaccine and Adolescent Health Promotion Initiative. The aim is to boost vaccine acceptance across all local government areas in the state. UNICEF appealed to parents, teachers, principals, and stakeholders to support the state government and partners in ensuring girls within the target age group receive the vaccine on time.
We have realized that the HPV vaccine in some LGAs have a low performance in terms of its uptake. And what is also critical is the fact that, again, the focus is 9-year-old. The data shows largely that we do not have a good response in terms of the uptake for this age group. And hence, this meeting today is to again reconceptualize stakeholders in Osun State, ensuring that the momentum doesn't drop. While we're talking about routinization, there need to be some kind of increased effort in ensuring that we don't drop the ball. We need to be able to intensify our targeting, ensuring that particularly because we're talking about adolescents, there is a need to change the methodology in which we target them. Yes, we know that they can't give consent. We need parents to be able to give consent, but we need to be able to target how we reach them differently. So in this meeting today, while we're meeting with stakeholders to change and re-engineer the way they think about this, we also have brought to the fore the need to work with young people to reach young people.
UNICEF works with all stakeholders across board with regards to demand generation to ensure that vaccines are continuously demanded for. Also, beyond that, UNICEF also provides the vaccines, because beyond increasing demand or actually creating demand for it, we ensure that these vaccines are there. So when we create demand, we also ensure that the services are there for the children to access.
The Osun State government, on its part, is stepping up efforts to dispel myths and misconceptions about the vaccine.
In terms of the government's role, number one, the First Lady, Chief Mrs. Titilola Adeleke, in April, she came out as the First Lady of Osun State and as the mother to enlighten and sensitize the people in the state, most especially the market women, all the political women, and also those who are not even in the non-politicians, to create awareness of the acceptance and how safe the vaccine is. That's the first role. And then the second role is that the governor has been trying to make sure that these vaccines that are available down to the grassroots are in good condition.
Participants at the workshop agreed that building trust is key and emphasized the role of health providers in clearly communicating the vaccine's benefits and safety to the public. In Osogbo, Kaudi Oladosu, NTA News.